Well, don't shrug it off. Here today to talk about the most common shoulder issues and treatments is Dr. Ammar Anbari, a board-certified orthopedic surgeon with Hartford HealthCare. Doctor, welcome. Thank you for being with us.
Thanks for having me.
So what is the most common cause for shoulder pain in adults over 50?
Well, we see it a lot nowadays, obviously, with the snow and the ice you guys were just talking about. Most common things that we see is patients complaining of rotator cuff issues. The rotator cuff muscles are the muscles that surround the shoulder, and it varies from things like inflammation or tendinitis to an actual tear in the rotator cuff muscle. Patients usually describe a lot of pain and weakness with overhead TAPA activities. And of course, in the winter, we see it a lot more than we see it in other seasons because of the snow and the ice.
I can imagine. All right, what is the most common cause for shoulder pain in younger patients?
Well, I see a lot of patients in high school age and college age, and those patients, unfortunately, deal with a lot of instability, shoulder dislocations, and things like that, sometimes tendinitis in the biceps because of sports that they play. We don't see any rotator cuff issues in younger patients. We see it mostly in the older population, but in the younger population, we mostly deal with, things like instability and shoulder dislocation.
Doctor, have there been any advances recently in shoulder replacement surgery?
Yeah, actually, absolutely. I'm sure everybody talks about robotic knees, robotic shoulders, robotic hips and robotic knees. Now there's, this new design we're working on to build the robotic component for the shoulders. As you know, we always strive to improve the implant fit and the design so patients can have good range of motion and stability after they have their surgery. And just like we've seen the great results in the robotic hips and knees, now we're actually working on the same product for the shoulders. I'm on the team that's actually developing this application, and that application should be ready in the next couple of years where we can do the robotic shoulder. It's just like we do the hips and the knees, and that's just going to change the way we do things dramatically.
What can patients expect when getting a treatment for a shoulder injury? And tell us about your upcoming webinar.
In most cases, when patients present with shoulder pain, we can treat them with things like physical therapy, cortisone injections, and a lot of times, just by modifying activities, people get better. And of course, as a surgeon, I treat a lot of patients with surgery when nothing seems to help them. These are a lot of things that I'm going to be talking about tomorrow. We have a webinar tomorrow evening at 5:30 that talks about the things that I just mentioned, a lot more detail, obviously, and mentioning some other things too.
All right, Dr. Ammar Anbari, thank you very much for the great information on shoulder pain and shoulder surgery. Thank you.
Thanks for having me. Take care.